Good evening. This is Marie Holiday. I hope everybody had a great day today. And before we get into today's lecture, please hit that subscribe button and notification button. Share my channel with one person you know. And I really do want to thank everyone for blocking out time, viewing my videos, supporting my channel, subscribing to my channel. And if you have not subscribed, please do so, because this channel cannot be possible without supporters and subscribers. So with that being said, let's get down to today's lecture. The focus of this lecture is going to be addiction, substance use, and recovery during the COVID-19 pandemic, part 2. Please check out my video upload from yesterday on addiction, substance use, and recovery during the COVID-19 pandemic, part 1. So today is a caveat to part 1, so pay attention. First of all, before I get into the meat of this lecture, I just want to present that, first of all, COVID-19 related social isolation and stress can increase susceptibility to substance misuse, addiction, and relapse. And I'm here to tell you, substance use can lead to immune system, respiratory, and pulmonary changes. It may increase susceptibility to the COVID-19 as well as other complications. And I'm here to tell you. So I want to point out that there are also health risks resulting from chronic alcohol drug use, as it weakens the immune system and puts stress on the heart, the respiratory system. And I'm here to tell you, over time, excessive alcohol and drug use can also contribute to many other alcohol and drug related health problems, certain forms of cancer, alcohol and drug related diabetes, cirrhosis of the liver, bleeding ulcers, and the list goes on and on. So in knowing that, I want to talk about 3 specific health risks that can be linked to substance use. And the first one, I'm going to put emphasis on methamphetamine. Methamphetamine use is particularly dangerous because, first of all, it constricts the blood vessels. It causes heart problems. It can damage the heart, hypertension, and I'm here to tell you. Smoking and vaping. We know that when you smoke or vape either tobacco or marijuana, you are at risk, according to research, for health consequences such as cancer and lung damage. It does a number to the lungs over time. In addition to smoking, emerging evidence suggests that vaping can cause damage to the lung cells and inflammation to the lung tissue. It's just a lot of unknown about the vaping, but as it has become more popular, life-threatening complications have resulted from excessive use of vaping. In addition, this reduces the ability for the lungs to respond to infection because the COVID-19 specifically attacks the lungs. So smoking and vaping may pose serious risks to those who contract the COVID-19, and I'm here to tell you. So there's more of a reason to begin to make some behavior changes in stopping the use of alcohol and drug use, and the smoking and the methamphetamine and the tobacco use and the vaping. I want to also talk about number 3, focus on addiction and stress. People with addiction also have depression, anxiety, and other mental health related concerns. So during the COVID-19, the constant flow of stressful news may lead to increased feelings of worry, anxiety, stress. It's at a certain point, that's all people were watching, talking about, hearing it on the news, talking about it on the job, on and on, hour by hour, day by day. And for some people, it can become stressful. Although turning to alcohol or drugs may temporarily in the mind of the person help the person feel better, but they cause changes in your brain that will make you feel worse over time, and I'm here to tell you. So that's one of the reasons it's imperative that you seek healthy activities that will help you deal with stress and anxiety. Get some counseling, get a supported person you can talk to, get you some outpatient therapy, meditate. Some people may have to take medication, take your prescribed medication. There are a lot of 1-800 numbers out there that a person can call to get assistance. And also take a break from the news and social media where it's bombarded about all of the COVID-19 related problems and health related problems associated with COVID-19, job loss, and etc. So take a break from the news and social media with being bombarded with all that negativity. Do some alternatives. Watch a comedy movie or read a book or meditate. Spend time with family. Deep breathe. Anything other than sitting there and being bombarded and watching all of the negativity. So I just presented 3 specific health risks in relation to substance use and connecting it and linking it with COVID-19. So now I want to present some resources, because the disease of alcoholism or drug addiction thrives on secrecy and loves to catch people off guard. So it can progress quickly, especially during the COVID-19 social isolation. So if you're dealing with strong cravings or relapse, please contact your local provider, your local health department, your sponsor. There are a dozen of 1-800 numbers out there. Support of friends and family. Keep your current appointments that you may have. Many providers are offering virtual assistance, web chat, or you can pick up the phone and call them to get some assistance. So there's a lot of services out there for people to assist them in dealing with alcohol use, drug addiction, potential relapse, stress-related issues surrounding the COVID-19. So ladies and gentlemen, that's all I have. Please do not forget to hit that subscribe button. Please hit that notification button, subscribe to this channel. And with that being said, simplify, and I'm going to leave you in the care of your own conscience.